Thank you, Julie. Well, if your New Year's resolution was to drop some weight, it is definitely not something to lose sleep over, and we mean that quite literally. Poor sleep patterns can actually contribute to weight gain, and our next guest will explain how that works. Dr. Thomas LoRusso is the medical director of the Northern Virginia Sleep Diagnostic Center. Dr. LoRusso, good morning.
Thanks.
I introduced myself by saying I'm Allison and I don't get enough sleep. And you said there's no answer to that, sadly.
It's hard.
All
it's
right.
hard when you get up at 3 o'clock.
Just want to get that out of the way. Let's talk about the function of sleep and its effect on your general health.
Correct. I mean, you need to get adequate amounts of sleep to feel both mentally and physiologically restored. There's certain chemical changes that occur when you're sleeping that allow you to become more awake. So it's essential you get not only good quality sleep, but adequate amounts of it.
How would that relate then to your effort to lose weight or maybe keeping on the weight if you don't get enough sleep?
Well, recent research has shown that lack of sleep can result in the production of hormones that interfere with appetite. They can actually increase appetite and interfere with the production of fat. So people that were sleeping 6 hours or less, we found, had a lot of difficulty getting the weight off. This can lend itself to further weight gain in a vicious cycle. For example, sleep apnea, disease where people snore loudly and stop breathing at night, can further deteriorate one's sleep. So one really needs to think about getting adequate sleep when you're trying to lose weight.
I think anybody who's got more than 3 friends, you've got 3 different sleep time ideals. I have some friends that, I just need 3 hours of sleep. That's crazy to me. Some people need at least 8 to feel like they're awake. How do you know exactly what you need, and does it change person to person?
Well, most individuals need between 7 and 8 hours of sleep. One way you can kind of get a feel for that is, on a weekend when you don't have requirements to get up, how many hours do you really need to sleep, and do you feel well after that period of time?
There's a study that came out that it's both disturbing, a little alarming. It talks about kids with that have poor sleep patterns and some of the effects that they might see later in life. And we're talking about prone to develop anxiety, depression, a bend towards substance abuse even. Seems a bit extreme. Can you tell us about this study?
Yeah, there was a nice study, looked at children very young. One part of the study was age 3 to 8, and they found that there was a correlation between poor sleep at that age and the development of anxiety and depression. A subsequent study in a little older group of children showed that behavioral problems such as drug abuse, alcohol abuse was much more prevalent in those individuals that had poor quality sleep. So a lot of the psychiatric physicians now are really trying to promote good sleep hygiene very early on in life.
Let me ask you, just for the kids and for older people too who just can't sleep beyond however many hours a day, are there ways to maybe make the room a little more conducive to sleep? Are there things that we can do at home if you just can't sleep?
Yeah, I think that the key thing is to try to keep a fairly regular sleep-wake time schedule, particularly getting up at the same time. Shut off the electronic devices at least an hour before you go to bed. You try to do some relaxing things such as reading, listening to some quiet music. Avoid caffeine later in the day. Look at any medications you're taking. Sometimes people are on decongestants or allergy medicines that can contribute to sleep problems. And exercise, that can help, but don't do it too close to bedtime.
You have some tips for signs that you should get a sleep evaluation. They include daytime sleepiness, sleepwalking, nightmares and/or insomnia, violent tremors, sleep talking, loud snoring, and restless leg. We hear about restless leg syndrome, but when you're sleeping, you're talking about that leg's going.
Right.
Leg is going.
The legs can kick, and they can also interfere with your ability to get to sleep. So it's common as you get older.
All right. We're all going to try to get some more sleep here on the morning show. We appreciate Dr. Thomas LoRusso for you stopping by today. And Dr. LoRusso is the medical director at Northern Virginia Sleep Diagnostic Center. Easy for us to say, right, Steve?
Yes, try.